So thank you, everyone, for tuning in, and welcome to CTO Talk. I'm your host, Matt Ferrari. On this 30-minute program, we are going to discuss the issues, challenges, and opportunities that are impacting healthcare technology. As always, you can follow the show on Twitter at #CTO Talk or follow me at MP Ferrari. With me here at HIMSS, I am lucky enough to be in the presence of Betsy Keenan Brown, VP of Clinical and Population Health Analytics at Fairview Health Services, and Brita Hansen, Chief Medical Officer. Welcome to the show. So today we're going to be discussing a lot around clinical process improvement, a lot around self-service access to data, and really excited to dive right in. So I'd love to get a little bit of a background. Can you tell me a little bit about Fairview Health?
Yeah, so we're based out of Minneapolis, Minnesota. Quite large organization in the state, 32,000 employees, 2,400 employed MDs, both in the metropolitan area as well as in the rural areas. We are in the process of transforming our organization, so it's a really interesting time to be a part of this. We've grown up with a series of mergers and acquisitions, which has created all sorts of interesting challenges when it relates to data. Yeah. And we're going through a huge one of these right now. And so data governance and the tools that support that are just absolutely crucial right now.
Absolutely. So thank you. I've now been to 5 HIMSS, and data governance continues to be a larger and larger topic every single year. So Brita, would you mind kind of introducing LogicStream and kind of what you guys do?
Sure. So we also are based out of Minneapolis, Minnesota. So we are a clinical process improvement software company. And so we work directly with health service customers, health system customers, really helping them to look at their clinical process. And so we do some degree of analytics with that, so to help them understand what's going on in their clinical process, but we also help to empower them and to actually do work for them to improve their clinical process. So Fairview has been our customer for quite a long time and has been on this journey with us. And so have a lot to add about how we make decisions from the information we get from LogicStream. But again, we're working with all sorts of different users throughout the organizations we work with. So everything from helping customers manage their EHR to optimize it and manage their CDS content, to working with quality improvement teams to actually drive quality outcomes. And we're doing a lot on the resource utilization, so appropriate utilization of medications, labs, et cetera. So we have a lot of different users within our organizations.
That's great. I'm certainly curious, actually. I would love, Brita, to know, as you think about the mission of LogicStream, would you mind kind of telling me what is the mission? Most of our viewers and listeners are either providers and CIOs or folks that are running ISV or SaaS companies. And it's always interesting to me when a healthcare provider or a CIO asks me, hey, what is your mission and how are you actually serving healthcare?
Right.
And it's a tough translation when you're a tech company.
Yeah.
So what do you think about those things?
Yeah, absolutely. So not to sound trite or whatever, but our company was started by clinicians and we all came from the healthcare space. So our co-founders are a pediatrician and a pharmacist, both coming from the health system space. And I was fortunate enough to be working myself with one of our co-founders when he came up with the idea. So essentially we say first and foremost, we're here to improve health and save lives. And that's a big goal, but the way we're tackling it is, again, through clinical process. So we found that there was just a big gap in that space. That there's a lot of work going on to improve quality and to improve outcomes in healthcare. And every day when we on the front lines of healthcare are going to work, we're working on improving our processes of care to drive better outcomes, whether it's quality outcomes or satisfaction, et cetera. Sure. But we often have no way to really understand what we did in the process itself. Right. And so if we made changes, did it help? And if it's not driving the outcomes we want, where do we intervene? So we really wanted to open up that black box and show people what's going on with your clinical process. And so, to get really more technical, I guess, we look at 3 distinct data types, and it's unique. I've never seen anyone else do this, but essentially we think to understand the entirety of your clinical process, you have to understand the steps of the process, kind of what are the things happening. You have to understand what's going on with your clinicians, who are the ones following the steps or not following the steps. And then finally, you need to understand the patient level data. So what groups of patients do these steps apply to? And it's really only when you can put all 3 of those together and analyze them that you understand really what's going on with your clinical process. And so, we see a lot of ways that you look at patient populations, but you can't really tell what the clinicians are doing or
Absolutely.
what steps apply. So that's really what we're trying to get at. And, back when we first started thinking about this, we started doing it manually. And our co-founder said, we can do it. We can make a software that does this for us. So that's where we are.
That's very helpful. I know later in the conversation, I'm going to want to kind of follow that rabbit hole for a moment, if we can, because a lot of the topics that I've been talking about here at HIMSS this year have been around making more intelligent clinical decisions with data and change. How do we get practitioners to actually believe in change and adopt? And I'm sure that you have some interesting insights there. If I had to guess,
absolutely.
Betsy, I'd love to know from you. Regarding Fairview Hospital and living its mission and values, would you mind kind of giving me a purview into the vision and the mission there and how you guys reach out?
Sure. So, as I mentioned, we're in a transformational period right now where historically we were in a regional-based model. We are switching to a horizontal service line model. And we're really trying to realize the full potential of our partnership with the University of Minnesota so that we can bring together community, research, academics to really offer more back to our communities. And so we spend a ton of time partnering across in this space, and our leadership team at an executive level is reforming as well so that we have good dyad partnerships across these different facets of the care delivery. At the end of the day, what we're really committed to at this time is we have to do this because we have to own the complexity for the patient. Mm-hmm. Our patients deserve more out of us. They shouldn't have to worry about how to get access, how things are going to happen throughout their experience. And so we are committed to owning that. And we think that in order to do that, we need to use data and analytics as an enabler to sort of see those insights around how we're going to change, how we're going to transform, and ultimately give back to our patients and families we serve.
That's great. One of the things you said in your opening was kind of growing up through almost an acquisition model. And I assume that leads to data sprawl, if I had to guess. As you think about data governance in IT, in clinical decisions, how can you describe to the audience how these things are different and ultimately how do they work together?
Yeah, and they have to work together. It's a critical aspect. At the end of the day, IT is a huge enabler of CDS and of data. And so, we need to be able to have access towards IT solutions, to the technical resources. And then from a CDS and data governance perspective, I feel like it's a life cycle that informs each other. Good CDS generates clean data that we can use for actionable insight. Once we learn those pieces, it informs the next things that we need to build out to try and help drive those changes in behavior. And so we have very intentionally tried to bring these together. Our Chief Data and Health Informatics Officer actually runs our informatics, CDS, and analytics program. Oh, wow. And that was intentionally brought together so that we could have these synergies realized.
Okay, excellent. And we oftentimes, especially here at HIMSS, talk about kind of outcomes as a service or best case scenario, but I'm sure along the road you saw challenges, as you thought about establishing data governance. So would you mind describing to the audience what challenges you saw along the way and how you overcame them?
Yeah, and we're still overcoming them because I think one of the things we have to level set on is data governance is never done. Mm-hmm. It's an important part to feeling sustained energy to keep the momentum going. And so I think having that mindset helps us overcome those challenging days where it feels like it's just not working. But from an approach perspective, we actually did, I think my leadership team, we have a lot of experience doing this in different organizations, but Fairview is very complex. We have all these different data platforms, many different governance structures operationally. And so we felt like we needed some help assessing and really educating our executive team around the importance of this and why we have to commit. And so our journey started there. And we brought in some partners to help us with that so that not only it could create bandwidth to really dedicate this, but so that we had some unbiased feedback that we could point at to say, this is why, and here are the risks of us not doing this. It created a safe space for us to negotiate some of these pieces as well. Because as you can imagine, sometimes the community world and the academic worlds don't always fit together real well. But having somebody that can facilitate that in a safe way really helped us get going with some good momentum. And then I think the other aspect as well is that you have to find those wins. You have to continue to sell that story. And so, right now, there are certain parts that just don't make sense for us to continue to push on based on where the organization's at. And so we find that next layer of work. And so it's a really interesting aspect of how we're partnering with LogicStream as well, because we've gone back to the basics of process. We maybe can't do huge strategic road mapping with our executive team right now because maybe we don't know who the right decision makers are quite yet. So let's work on some of those underpinnings that are really going to help enable a better future.
You just said something that I find pretty brilliant and interesting. Today I had to give a session on how to pick vendors in healthcare, and we talked really deeply about roadmaps and RFPs. So would you mind, telling the audience the story of, how did you come across LogicStream? How did this partnership begin?
Yeah, and it predates me.
Okay.
So Brita can probably add to this as well. But, I think that we do have a philosophy where we like to find true vendor partners. And so we do seek, when we're RFPing, to find those that are going to come to the table, that are going to serve us well, and that we have those synergies. And they're local, right? So we're all in Minneapolis, and that helps really well. We can get together when we need to and get the work done.
Excellent. Anything to add there?
Yeah, so I was also not there at the time that Fairview signed, but I was around, so I know a little bit more of the story. I mean, again, part of it is because we were both located in Minneapolis at the time. Obviously, we are nationwide now at this point.
Sure.
But Fairview was an early customer, did a lot of development partnership with us. And, obviously, healthcare in general, health IT is a small community, and when you're co-located in the same city, we had a lot of common connections to begin with. But I also want to stress that, especially when we were working with a development partner, we want people who are forward-thinking. So, I mean, the model that Betsy just described about how their leadership structure brought those aspects of CDS and analytics all together in one, I mean, that just in and of itself is such a sign of kind of how forward-thinking they are about how to use their data and, not only what goes in and how it comes out, and then how you make decisions based on what the data that you have. And to be able to have that maturity helps a lot when you're partnering. So.
I'm glad you said that. That actually leads me to my next thought, Brita. The oftentimes in healthcare, I'm constantly reminded of innovative organizations and organizations that continue to float along, maintaining their various systems that may be dating back, 10, 20, 30 years, that they're scared to log into, touch, patch, those kind of things. Who is the ideal customer for LogicStream, thinking about kind of the innovative model you guys have?
Yeah. So I think there are a few things there. One is just the cultural readiness to tackle standardization of process. And obviously this is just a big topic in healthcare in general, and there's a big disparity in how far along that road different organizations are, right?
Absolutely. And,
I'm a physician, so I will take full ownership of this, that we are the worst group, right? We don't like change typically, and we don't like standardization. It feels like it's taking the art out of medicine, right? And so this is something I feel very strongly about, and I think that, Betsy, you kind of alluded to this, is that when patients walk in our door, we need to have a commitment to them that we provide them with the same standard of care, no matter who they are, right? And while we know there are always unique situations and outliers and patients who have special circumstances, that is not an excuse to not deliver the same standard of high-quality care. So I think there's always room for both the standardization and the art of medicine, but there's a lot of cultural barriers to overcome to get there. And so I would say first and foremost that. The second piece, which is different, is about, how they make use of data. So, so just very basic things that if you get information, how do you act on it? Do you have someone who's going to make a decision? I mean, so we talk a lot about, looking at the process in your EHR. So these alerts are bad. They're not driving the behavior you want, or these order sets are driving inappropriate behavior, or we have 50 ways to do the same thing. Who's going to make the decision that we're going to eliminate those things? And if you're at the point where, well, we're still going to say every doctor gets to do it their own way and we're not going to turn anything off, then they're probably not ready to make use of this information. So those are probably some big markers of the type of organization.
How can we, as a healthcare community, get them there? How do we get them over those hurdles?
Yeah. So, I mean, I have a lot of thoughts on this, but, I mean, I think, for example, that tackling variation in care in and of itself is very powerful. So instead of looking around the room and pointing fingers at any, one nurse or one doctor or even one department and saying, you're not practicing the way we want, instead it's taking that step back and saying, let's just lay out all of our practices and look at it and see we have tremendous variation. So, I mean, I had this powerful, when I was working in the health system side in the past of doing just that, we came to a group of surgeons and brought data around their practice of, preventing blood clots, their VTE prophylaxis patterns. And we just laid it all out and what the differences were across the various surgical groups. And everyone was stunned because they said, we've never seen data about our practice like this.
Oh, wow.
And then we all said, the enemy here is the variation. So let's tackle that together. So I think that's one way is that we get away from attribution problems. I mean, we all go down these rabbit holes of, well, that wasn't my patient or my patient was so sick. And instead, take it up a notch and say, let's look at the process. Let's tackle the variation in and of itself and look at our groups of clinicians and that we should, generally speaking, have a pretty standard way. So I could probably talk a lot more, but I guess it's one.
No, I appreciate it. A lot of as I talk to software organizations that are tackling, I won't say the same. I happen to agree with you that I haven't seen the same solution. Mm-hmm. But let's say similar solutions or trying to solve similar problems in the space. Time and time again, what comes up is how do we get clinicians' eyes to open up? Mm-hmm. How do we get them to see that this isn't the days of a stodgy EHR that doesn't provide you any insights that, that the world is changing. Betsy, I don't know, did you have any experiences at Fairview that, would correlate with that experience?
Well, it's all about the data, right? Yeah. Especially when you're engaging your physicians. They're highly competitive and they can be convinced with data, but not with anecdotes. And so transparency and taking an approach where it feels collaborative, let's solve this problem together. I'm not going to single you out because you're doing it wrong, really is helpful.
Excellent. And so if you're just tuning in, this is Matt Ferrari of CTO Talk, and you're talking with Betsy Keenan Brown, the VP of Clinical and Pop Health Analytics at Fairview Health Services, and Brita Hansen, the Chief Medical Information Officer. And so really excited of LogicStream, and really excited to really continue to dig into the details here. I'd love to switch a little bit to tech. So how does LogicStream's health software enhance clinical process improvement and control? How does that differ from traditional methods? And I'd love to just learn more about what that process looks like.
Sure. So, we talked a little bit about the fact that, again, we're looking at process, which I think in and of itself is fairly unique. And, really our platform starts by bringing together the three data types we talked a little bit about before. So the steps, and so those are steps in your EHR, so things that you order for patients, that you document on patients, the way you respond to alerts and questions. So everything like that is captured and together spell out all the steps in the care process. And then we look at the clinicians themselves. So whether it's at the group level, like your whole department or your whole hospital, if you're a multiple hospital facility, all the way down to the individual clinician level and seeing how they're interacting with all of that. And then finally, the patient data. So we don't focus on individual patients. So we're not asking, what happened with Mrs. Jones yesterday. We're looking at what is happening with all your heart failure patients. And so we're looking at patient cohorts to whom all of these steps apply. And the underlying it all is trying to get rid of unnecessary variation. So we're targeting that and trying to eliminate areas where there's a lot of variation. And so what we typically find is that your EHR itself is driving a lot of this variation. It's not the fault of individual clinicians. It's that you have 78 ways to do VTE prophylaxis or,
yes,
down that road, right?
Yes,
so
absolutely.
I could go on and on with examples. But
yes.
So trying to eliminate that variation, things like, you don't want everyone to have a Foley catheter, and you find that it's pre-checked in a bunch of order sets. So things like this that we're trying to streamline. And then we use it. So once the process is fixed, then looking at actual clinician behaviors and looking, are there outliers then who you may need to move forward with some change management?
Absolutely. It's funny. It's funny you mentioned kind of the deviations coming from the HR. I separately had a conversation, not a podcast, just a conversation with a clinician, and his frustration was all of the deviations that he has seen since the installation of things like ICD-10 and ICD-10 diagnosis codes have really driven not only a slowdown in many care procedures, but ultimately a lot of deviation where they end up having to double check the work, which makes them lose even more time. So I don't know if that's a similar experience than what you've seen.
Yeah. I mean, so usually, part of it is, again, a lot of the performance improvement work we're doing, and it's really well intentioned, but we keep building more layers of things on top of the next. So I always experience that if there's a problem, the request is we'll build another alert, build another flow sheet row, etc.
Sure.
And we do this over and over again. And soon our EHRs have layers and layers of these things. And so that drives so much frustration and non-standard work. So imagine being a new employee coming into a place. You're a new nurse, you're an intern, and suddenly you have 78 ways to order VTE prophylaxis, or 20 ways to document stool consistency, all these things that we see over and over again. And I mean, it's just so frustrating, right?
Yeah.
I mean, how do you know what you're supposed to do?
Absolutely. The next topic I wanted to talk about is another hot one actually here at HIMSS this week, and it surrounds kind of data privacy, data sharing, that kind of thing. And what I've seen is a lot of healthcare organizations have concerns about giving access or broad access to data insights and concerns around privacy, not knowing what's going to happen with the data, not understanding or adherence to data definitions, which leads to confusion or lack of consistency across the organization. I'd love to know, from both of you guys, how do you mitigate those concerns?
Well, I share the concern.
Okay.
But actually, the concern motivates me to figure out how we're going to do this safely.
Okay.
The days of waiting in line for IT to give you your data are long gone. We cannot move forward with that as a sustainable approach. And so the way that we're going to get the more simple questions answered is through self-service. And we have to get comfortable with that. And as long as you have a data governance framework around it that sort of shows what are your enterprise endorsed assets, what is sort of the gold star rating behind this, how much can I trust this information, you start to see really quickly what are things where I just need a quick answer, it's directionally correct, it's quick and dirty, and that is completely sufficient in most cases. Let's reserve the capacity of our scarce analytics and data resources to really focus on those hugely complex problems. And I think the great thing that you see on the other side of when you go down a path of self-service and allowing the freedom of your users to interact with their data is that all of a sudden the literacy, the fluency goes up. And what do you know? All of a sudden it's safe and it's great. And you've really risen that maturity of your organization in the process.
Yeah, absolutely. And out of curiosity, just as a follow-up question, how do you measure that? Thinking about success, do you have key performance indicators or KPIs that you measure that to kind of, shout from the heavens that, hey, this is working?
We are just starting that, actually.
Okay.
It's a great question.
Okay.
So through our lean work, one of the leading indicators that we have to sort of show that we are starting to increase and mature in this space is the number of requests avoided.
Got it.
And so even within kind of the analysis realm where we have elbow-to-elbow support with our operations teams, we still like to log and record the kinds of questions that are being asked and where we're maybe helping to support data, but maybe we didn't actually have to build anything. But let's get that check mark of, somebody needed something, and guess what? We didn't have to build anything. So really monitoring and having a huge emphasis and really rallying the team behind this is a good thing.
Absolutely.
Let's just kind of be in the know for now so that we can see how well this is working.
Thank you, Betsy. And Brita, the same question to you as you think about kind of data sharing and privacy. I'd love to know what your thoughts are.
Yeah. So, I mean, I agree with a lot of what Betsy said. So I guess the only thing I have to add is from our perspective, having seen this across a lot of health systems, we find the same thing is that, usually whenever some place brings in a self-service tool, there's caution about it. And I think rightly so, right? Because we don't know how people are going to respond. We want to preserve data definitions across our organization. But generally, we see pretty quickly the spread and kind of the relaxing of that once they realize exactly what Betsy just said, that it kind of has a snowball effect of increasing data literacy, data curiosity throughout the organization. And part of it is setting that expectation of what that Betsy already mentioned about directionally correct. I don't foresee any time in the immediate future that we're going to completely eliminate a traditional reporting analytics team. There's always going to be a place for that. But we all know every single reporting team around the country has a queue a mile long. It's not like they're not like we're taking away, they're not going to have anything to do, right? So it's about supplementing and increasing that data curiosity, the data literacy, and they augment each other so that once you start getting directionally correct, it informs better report requests, that the users understand a lot more of the questions to ask, and so you're just making much wiser use of your analytics resources if you can give your users, your end users, access to data.
Awesome. Thank you very much. I know that we're going to be running out of time shortly, which is unfortunate because I have a lot more questions about this topic, but I'd love to know, as you think about the future of Fairview Health Services, Betsy, what are kind of the next big wins, or what does the road ahead look like?
Yeah, so we have to continue this transformational work and get to the other side of that. And we will use lean principles to help us with that work, starting in a primary care space, and then, really working to maximize that full potential of the University of Minnesota as well, so that we can offer so much more back to the communities that we serve.
That's great. Thank you very much. And Brita, the same question. What's the road ahead for LogicStream Health? I'd love to learn more.
Yeah. So, again, we've talked a lot about the data side and being able to analyze your data. And, I think a lot of it is a lot more of being able to help our health systems not only understand what's going on with their process, but to actually fix it. And that's the part where, again, we, not only on the analytics side do we have limited bandwidth, but on the fixing your process side, we have a limited bandwidth as well. So, we're now at the point where people are like, this is great, we can understand so much, but oh my gosh, now there's a lot to do. So we're actually leveraging the software itself to actually do some of the fixing of the problems. So being able to actually tell you, here are where the problems are in your process. Here are the clinicians who may be outliers, and kind of automatically reaching out, so that more and more of that direction to really provide some extra assistance, where they need to be doing process improvement and have limited bandwidth to do it.
Thank you. That's very helpful. For the audience, thank you for listening today. Thank you, Betsy and Brita, for joining me today.
Thank you.
Please know, the audience, there are healthcare platforms and solutions and software organizations and providers that aren't just doing it for the tech. They're doing it to actually make impactful change in patients' lives. And it's always refreshing when I don't just have to sit here and talk about big data and containers and IP all day long, even though that's my life. So I really appreciate it. So thanks everyone for tuning in. If you have a comment about today's episode, check out and follow hashtag CTO Talk on Twitter, or follow me at MP Ferrari. You can always learn more about CTO Talk at healthcarenowradio.com and at cleardata.com. I'm Matt Ferrari, and until we talk again, have a wonderful week.